Hi, I'm Mike from the Physical Therapy Department here at Holy Family Hospital, and I'm going to be talking to you about how to prepare and what to expect when you have your total knee replacement or total hip replacement from a physical therapy perspective. So the first thing we need to talk about are the exercises that you can start to do pre-operatively, and then you'll end up doing them post-operatively as well. So now's the time to start in on those. So the first thing I want you to do is open the handout that you have to the page where your exercises are, so we can do these together. So the first one we're going to work on is very simple. It's for your ankle. What we're going to do is we're going to bring the foot all the way up and all the way down like this through a full range of motion. We often call these ankle pumps, and what this is doing is it's helping the blood in your lower leg to continue to circulate, which is very important through the early part of your recovery when you're going to be spending a little bit more time off your feet. So you're moving the foot through a full range of motion like this. This is also helping for the strengthening in your lower leg. So that's a very simple exercise. It's one you can start to do immediately. The second exercise we're going to do is focusing on your quadriceps muscle here. For those of you who are having a knee replaced, getting this muscle strong again is going to be critical for your recovery. It's also very important for when you're having your hip replaced. The first thing you're going to do is feel when your leg is outstretched like this, you have a little bit of a gap behind your knee. What we want to do is reduce that gap by straightening the leg, pushing the back of the knee down. What you're doing there is you're using your quadriceps muscle in the process. So once the back of the knee is pressed down to the surface, we know that that quadriceps muscle is engaged. You want to hold this contraction for 10 seconds. So I've been holding for about 10. Now I'm going to relax. So that would be one repetition. We want to get up to about 10 repetitions holding for 10 seconds. So again, pushing down. A good way to know that you're doing this correctly is if you can feel your quadriceps muscle engage, kind of tighten up here, you know you're doing it correctly. So that's the second exercise. The third exercise is for your gluteal muscles. So these are your bum muscles. The reason we are doing an exercise for these muscles is because they are highly involved in sitting to stand and also for walking. So anytime that you're not using these muscles, you start to lose strength very quickly. So we need to make sure that you're continuing to use those muscles, knowing that you won't be walking and climbing stairs quite as much as you were before. So this exercise, it's hard to visualize, but essentially what you're going to do is you're squeezing your two gluteal muscles together. You're going to tighten here. You're going to hold that contraction for 10 seconds. After 10 seconds, you're going to relax. You'll get a slightly better contraction here if you recline back. So you could do this on a sofa or in bed. The legs have to be up. You'll be reclined back. Again, you're squeezing both your muscles together, tightening, holding for 10 seconds, and relaxing. For this, you'd also hope to do 10 repetitions, holding for 10 seconds, and then do this various times throughout the day. So those are the three exercises that we'll use for whether you're having a hip or a knee done. There is one additional stretch that we'd like to talk about for those of you who are having a knee replaced. So the range of motion of the knee, meaning the flexibility of the knee, is very critical for your recovery. So the knee really moves in only one plane, forward and back like this. So we have to target both how much you can bend the knee and how much you can straighten the knee. So we're going to do that through two fairly straightforward, simple stretches. So the first one is for straightening the knee. So when I am sitting here with my knee on the bed or on a sofa, you have, like I said before, a little bit of a bend in the knee here. So the way to get the knee fully straight is simply by lifting the lower portion of the leg, putting something underneath the Achilles tendon there, and this allows the knee to go fully straight. So when you first do this, you might feel a little stretch on the back of the knee. That's actually what we're going for. We want to stretch out the tendons of the hamstrings back here. The muscles often get tight. So once you have the towel underneath there, you're going to keep it under there for 10 to 20 minutes. If you have significant pain and stiffness, 10 minutes may be a stretch. So you just try and push for those 10 minutes, and then you can incrementally build up to 20 minutes over time. So normally for our patients, we'll recommend that you do this 4 times a day. Try and space it out throughout the day. Usually you time it when you have your pain medication and you have your pain somewhat under control. So that's for straightening the knee. As far as bending the knee goes, we have a simple exercise that we do. It's normally here at the side of the bed or on a chair. All you're doing is you're going to bend the knee back like this as much as you possibly can. You're going to hold it in this position, and then you're going to slide it back out. Now we have ways of making this a little bit easier for you, and we'll talk about those when you come to the hospital, when we have a little bit more time to spend. So those are your basic exercises and stretches for your hip and your knee. Your physical therapist will advance those when you're ready, whether that's here in the hospital or by the time you get home and the physical therapy visits you at home. So next, I'd like to talk about home and how to keep you safe at home. So there are a few things that you can do in preparation for your surgery to make your house a little safer. And one of those things is try to remove obstacles from the ground. So if you have scatter rugs, you can get those out of the way. If you have pets at home, try and make a plan to keep the pets separate or keep the pets away from you for a short period of time, at least until you get your bearings at home. You'll also want to take a look at the height of your bed. If your bed is not adjustable and it's a very low surface or a very high surface, it's important that we know about that when you're coming in so that we can train you on how to get in and out of bed safely. Another thing that we look at is the height of your toilet, something that people sometimes take for granted. But after surgery, you may have restrictions or difficulty getting up from a low surface. So oftentimes, if you have a low toilet, we can help you to plan to make that a little bit easier through the use of equipment. So that's another thing to keep in mind. As far as getting into your home, if you have stairs, we'd like to know how many stairs you have. If you have a railing, if you have 2 railings and you can reach both railings, that's usually an advantage. You don't necessarily have to install a second railing. We will teach you how to go up and down the stairs with a single railing, but usually one is better than nothing if you have that option. So the next thing I'd like to talk about is just what your first day here in the hospital will look like from a physical therapy perspective. So let's say you have the surgery on a Monday. Oftentimes we will come in to see you that very day for physical therapy, and what we'll be doing is a basic evaluation. We'll ask you several questions, some of which have to do with your home setup. Others have to do with the amount of support that you have at home through family or friends, and so on. So once we ask you those questions, we'll test your strength, we'll test your sensation, make sure that it's safe for you to get out of bed, and then we'll go ahead and stand up and go for a walk if you're able to. We'll go over your exercises again that day, and then we'll just make sure you're comfortable. We'll make a plan of care with your medical and nursing team to make sure everyone's on the same page, and then we'll plan to see you the following day as well. So that following day, we have 2 sessions that we can see you for physical therapy. So let's say in the morning, you're feeling a little groggy and we feel like you might need a little bit more time in the hospital before we can get you home safely, then we'll see you for a second session. Usually that day, occupational therapy will come in to visit you as well. And occupational therapy is concerned with your ability to bathe and dress yourself and to get in and out of the tub or the shower safely. And they may provide you some tools that you can use going forward that will make your recovery a little safer. So I'd like to show you some of the tools briefly that occupational therapy may use. Once you're here in the hospital, they'll go over these in detail, but this is just a quick run through. So one of these tools is a long-handled sponge. So this is something that will make you a little bit safer in the shower so you don't have to bend quite so much. Another device here we have is a sock aid. So this will make it a little bit easier for you to get your sock on. You won't have to bend down quite so much. We also have a long-handled shoehorn here, which most people are familiar with a shoehorn. Again, you don't have to bend quite so much getting your shoes on. We have a reacher. So you can tell the theme here. All of these things are going to make it a little bit easier to get things from from lower down where bending will be an issue. And finally, we have this device which is going to help you with dressing, and the occupational therapist will show you just how to use this. So in terms of pain control from a physical therapy perspective, one thing that we know is that ice and cooling can help to reduce swelling. And if you can manage to reduce swelling, you can oftentimes reduce the pain. So what I have here is what is called a CryoCuff device. And what this is essentially an ice bucket that's motorized, and it has these tubes that feed water in and out and keeps these cells within this cuff cold. So what you're going to do is, for those of you who are having a knee replaced, you're going to put it right here on your knee. You're going to strap it on, and we're going to keep it on enough so that you can try to reduce that acute swelling that you'll have just after the surgery. We do have some restrictions with the use of this because we worry about frostbite and damaging the skin. So we'll talk more about this in detail when we see you in the hospital, but basically we don't want you to overuse this. We want you to keep a barrier between this device and your skin. So the next thing I'd like to talk about is the transition of care. So when you return home, when you're safe to return home, we will send a physical therapist home to visit you there. The physical therapist will advance the exercises that we've started. They'll progress you to more dynamic exercises, and they'll also take another look at your home to make sure it's optimized for safety. So you usually expect to see the physical therapist 5 to 8 times at home before you're ready to transition to outpatient physical therapy. And we have an outpatient physical therapy clinic associated with this hospital. That's one option. Once you get to outpatient, you're going to start working on further dynamic exercises, including treadmill, bike, weights, things like that. So it is important that you start to think about the long-term plan of care and that you know what to expect, how fast things are going to progress, and who's going to be helping you through your recovery. So thanks for joining us.